Surviving a stroke is often just the beginning of a harsh physical reality. For many, the simple act of closing a hand into a fist or gripping a household object becomes a grueling daily challenge. Recovering that basic motor function requires consistent professional physical therapy, but those face-to-face clinical sessions come with a heavy financial burden that quickly exhausts family savings and puts long-term care out of reach. There are also immense geographical barriers. Patients living in rural or isolated areas are forced into exhausting travel routines just to reach specialized clinics for brief appointments. Physical recovery is a long-term commitment that relies on consistent access that often breaks down under the weight of high costs and long distances. The market has attempted to bridge this gap with digital health devices. However, these setups usually mandate thousands of dollars in specialized electronic sensor gloves and highly complex hardware configurations. They also run on rigid, standalone software programs that require difficult local installations, frustrating the exact demographic of vulnerable patients they are meant to help. So, how do we replace proprietary, expensive medical hardware with everyday consumer technology? A research team from University Technology Mara recognized this friction and built the AI framework for hand kinematic rehabilitation, or AI-HKR. It is a serverless, zero-budget home rehabilitation platform designed to completely repurpose the technology patients already have in their living rooms. For patients, the experience is entirely frictionless. There are no apps to download, they simply click an open-access web link. Sitting in front of a standard laptop or smartphone webcam, the camera captures raw video frames of their targeted physical therapy exercises. The system uses an Edge AI engine, running an image classification model locally inside the web browser. It actively evaluates and sorts incoming movements into two distinct clinical targets: hand flexion, a full fist grip, and hand extension, an open palm. By processing this data locally, the system turns a standard passive consumer webcam into an active, real-time computer vision motion sensor. The browser continuously monitors the physical exercise, waiting until it registers a 90 to 100% classification confidence that the patient has executed the task correctly. The system uses the native Web Serial API to establish an instant line of communication straight through a standard USB cable. The data travels to an affordable open-source microcontroller, which triggers built-in LED arrays and a piezo buzzer for instant biofeedback. This unbroken loop from the web directly to the hardware creates an interactive, automated rehabilitation partner. And the patient operates it completely independently. Because this framework uses the patient's existing hardware and open-source web tools, it operates at a 100% implementation cost efficiency, effectively removing the need for any new proprietary equipment. This approach eliminates software development costs, bypasses App Store premiums, and entirely removes the need to manufacture or purchase expensive electronic sensor gloves. For the patient, this translates directly into economic relief. It cuts out-of-pocket medical costs and ends the constant travel expenses associated with chronic healthcare. Clinical-grade task evaluation is moved out of the hospital infrastructure, placing the tools for recovery directly into the living rooms of vulnerable patients. This chart highlights the project's market readiness. It confirms 100% market novelty for this web-to-serial system, alongside a 90% clinical feasibility rating. To sustain value, the project introduces an affordable subscription model priced between 30 and 70 Malaysian ringgit per month. That low financial barrier ensures rapid scalability. Healthcare providers can deploy the system across vast, geographically isolated populations who previously lacked regular therapy access. The future of telehealth relies on creating smarter, open-source loops that democratize access to human recovery.